Good morning, everybody. I'm very thankful of Marican for inviting me, to give me the opportunity to give a short presentation this morning on ergonomics, risk management and strategies and interventions at workplace level, I suppose from a health and safety authority perspective. I suppose my presentation this morning, I thought the title of the actual conference, Back to Basics, is a good one, because sometimes it's important to kind of take stock and think of where we came from and where we want to go. So my presentation this morning will just have a brief overview of ergonomics, the definition of ergonomics, and explain its legal context from the Health and Safety Authority's point of view. Briefly, discuss the regulation, the manual handling regulation, and talk about some of the statistics and injury statistics that we see ourselves from other sources as well. And finally, I suppose the most important aspect really is to talk about where our focus primarily will be from certainly in the immediate future around the whole area of ergonomics risk management, which takes in a number of different elements. So, I'm sure with the audience here today, they're very familiar with ergonomics, but it's still important to kind of take time to consider it again. I mean, ergonomics, it is the study of work that people do, and I think even that first point is very, very critical, because sometimes that can be lost in the process. When you talk about and think about risk assessment, when you think about training, when you think about what kind of things go on in workplaces and what kind of things may need to be looked at. Certainly from our point of view, when we visit workplaces, it's one of the first things I would always ask, is, well, what do you actually do here? What's your business, and can you tell me a bit more about what kind of work you do? And then probe a little bit more. Well, can you tell me, what are there aspects of the work where there may or may not be significant manual handling? So it's around understanding as well the interactions of people with the work environment, the equipment they use and the materials they use, from the context of seeing how that fits in with the kind of work that they have to do, and potentially what issues there could be. So I mean, this is just a kind of snapshot of some of the things that we have on our website in terms of looking at the kind of work people do, thinking about what can be improved. Are there things that could be done differently? What kind of training may be required? What kind of control measures may be needed? And then implementing those measures so that you're kind of reducing the likelihood of someone suffering a serious injury or suffering ill health. So I mean, those case studies that are on our website are very much related to experiences that I have had with colleague inspectors, looking at issues, trying to identify what the risk factors are, trying to probe the employer in terms of, have they looked at the work activity, have they considered what the potential risk factors are in terms of, possibly awkward postures, high repetition, high forces, high long duration of highly repetitive work. So it's really kind of digging into the very basics, but those basics are critical, because if you don't get those basics right, well, then you potentially see yourself in a more difficult position. And ultimately, I mean, when we talk about ergonomics and looking at all these aspects and looking at the work that's been done, it's very much around trying to design or plan the work in order to optimize the human well-being and performance. And that would be a key part of the definition of ergonomics. So, with that in mind, it's important, I suppose, to look at how ergonomics fits in, and what we're talking about. We're talking about a system of work. I mean, this example is just a very simple example again of in a kind of a healthcare setting where they're dealing with chemicals and handling them and the heavy loads, and looking at a better system of work. Can we reduce the risk? Can we introduce some changes? So from that point of view, it's important to look as well at the context of ergonomics, how it kind of relates to our regulation in Ireland. I suppose the key areas where the regulation and ergonomics would match would very much be, as you know, the manual handling of load regulation, which we'll talk about briefly, the display screen equipment regulation, also the Safety, Health and Welfare at Work Act, because there are certain aspects of ergonomics, particularly where people are involved in, say, highly repetitive assembly type work, that wouldn't possibly come under the I suppose the area of the manual handling regulation. So there are aspects of work that need to be assessed. So you're looking at safe systems of work, because there are duties there for employers to provide safe systems of work, and this is where ergonomics is very, very much a factor. And another area I suppose we sometimes might forget is in the actual hierarchy of controls of prevention, and there's a very much a point in there that talks about adapting work to the individual, which again is a very simple definition of ergonomics. So there are a number of areas where it actually, I suppose, presents itself in our health and safety legislation. The manual handling of load regulation has been around for quite a long time now. It's actually 25 years since it originally was drafted at a European level as a directive. It was transposed into Irish regulation in 1993, and it was updated again in 2007 after we had brought in the new Safety, Health and Welfare at Work Act. And as we all are aware, that the key focus of this regulation is on prevention of injury, particularly back injury, and it talks very much around about the area of risk assessment of systems of work, looking at what the potential risk factors are. It talks about when you do the risk assessment, taking account of the schedule and taking account of those risk factors. And again, getting back to my earlier point, you can only do that effectively if you've actually spent time looking at the type of work people are doing, collecting the relevant information about the job, and then from that basis making a sound objective judgment as to what kind of improvements may be needed, what kind of risk factors exist. So ultimately you're looking at avoidance of high risk handling, reduction of the risk if avoidance can't be completely eliminated. So again, we're very much into sector specific guidance now on risk management, risk assessment. Again, in the hospitality sector, it's an example of the kind of thing you would see. It's looking at the work that has to be done. The kegs that have to be handled, they have to be lifted. They weigh 80 kilos each. You don't see 80 kilo bags on construction sites anymore. We have 25 kg bags, that's it. So, you talk about a barrel that has to be lifted. How are you going to do it? You look at some sort of a system of handling it. If you can avoid it all, stacking kegs, well then you look at that. If you can't avoid stacking them, well then you've got to be looking at some sort of a system of handling. In the healthcare sector, and I know there's a number of people here today from healthcare, again, it's foreseeable that if a patient has a serious illness or they're having issues with mobility, that it's likely that they may fall. I know a lot in the health and the HSE, there's a lot of focus now on fall prevention programs. And again, it's, if someone does fall, to have planned how you're actually going to get that patient up into a safe position, so that you can prevent further injury to the patient, but also prevent injury to the actual nurse or physiotherapist or whoever, the porter, for example, that may have to handle the patient. So again, it's looking at that focus. And the workplaces are changing, as we know. We're currently in the grips of a recession, and work is changing. But I think the basic principle still applies, that we still need to understand and study the work people do in order to identify the potential risks and in order to look at opportunities for risk reduction. And I have to say, from my own experience in the last 15 years, there are things that companies do that are very innovative, whether they're small or whether they're large. And it very much depends on the individual that's involved, if they've actually been aware of what's required, or if someone has a kind of an interest in the area, or if they have a kind of a technical aptitude in terms of maybe looking at some sort of engineering innovation that could be put in place to improve the work activity and reduce the risk. So I suppose there's a number of things that we need to recognise as well. There isn't enough risk management, emphasis on risk management. There may be a number of reasons for that, but certainly in the last number of years we've tried to underline that through a number of, I suppose, sector-specific guidance documents that we've produced on the subject of risk assessment. And I'll talk about our kind of a focus now on risk management in a few minutes, but we certainly need to kind of recognise that is a key issue. In terms of training, I mean, there's been a lot of very good work done on training, in terms of training providers being accredited with VTAC, instructors being trained up by those training providers, and it was a huge body of work for those involved in training to do that, and they should be recognised for that. But I think what we need to do in terms of training is, as well, we need to kind of focus, it's important, the techniques are important, but maybe look at training, take a step back in terms of what training should also be looking at, and how it's important to maybe make sure that it's tailored to the work that's being carried out, but also maybe to kind of align it with the results of risk assessment, so that if we have changed systems of work, if we have introduced improvements, that we bring that together with training and introduce that concept so that the training has credibility. Because the last thing you want is to lose credibility providing training, as you well know, if the training that's provided, it doesn't relate to the actual work people are doing on a day-to-day basis. So that's an important element. So again, in examples like this, for example, this was a situation in a company where we visited where this was an activity that had to be carried out, where material had to be loaded into a hopper. This guy was going up and down stairwells. He was lifting heavy loads. They hadn't really looked at this issue in terms of potential risk, but they had provided training. And they had provided training, the kind of standard training, on how to kind of maybe lift the load, but they hadn't really looked at this work activity. So I suppose inherently there was still a serious risk there. So, training is an important part of the solution, but it must be related very much to the risk management and risk assessment process as well. So a priority needs to be on improving design, looking at planning work activity. I was in a workplace a couple of weeks ago, and just to show you the kind of what you can see sometimes. I mean, they had a very good workstation design process in place, that even before they actually put the workstations in place, which is the ideal situation where you can get the design in at a very early stage. And it was a very credible process that they had in place with very credible kind of interventions to improve the work activity. So we need to look at more effective control measures or safe systems of work which focus on engineering or organisational improvements. Now this may not seem like, well, that's exactly what the regulation says, but unfortunately, we still have to kind of work on that aspect. I mean, this is another example from a very small business where a colleague inspector had concerns, and this activity really relates to the guy in the flatbed truck lifts these carcasses onto the edge of the flatbed truck, and the other chap has to carry the carcasses over to a weighing scale. Now, again, the very basics, it's a 100 kilo load, it's repetitive, there's a lot of handling, and in this situation the company was very proactive in trying to find a solution. They got in, they were a very small company, they basically broke down the meats and supplied butchers, but they got a local guy in, a local engineer around the corner, and he helped them come up with some sort of improvement solution. And what they did was they redesigned their incoming area so that weighing scales was just inside the incoming area. They brought in a lever system for the flatbed trucks, over the trucks, so that the carcasses could be raised and lowered, and they introduced a ratchet system to transfer over the carcasses. That's what they were looking at. That was their final part of the process. So we talk about the regulation. It's about avoidance, but it's about reduction as well. It's about trying to look at solutions and work with that. So that's, the background of where we're coming from. But the statistics, unfortunately, they're very stubborn. We get about 8,000 accidents reported every year. 1 in every 3 of those accidents relates to injury due to manual handling. That hasn't shifted much in the last number of years. We get 8,000 accidents reported, but if you see the figures below that, that 25% of the 12,000 occupational injury benefit claims that were claimed from social protection in 2012 related to injuries due to the back, disc and muscle. So you look at that 12,000 claims, right? We get about 7,000 or 8,000 accidents reported, and these are claims for people who got injured at work. So again, that's another area that we as an organisation have to look at, why there's under-reporting. But if we look from the context of manual handling, we can see that there are serious issues still there. There are serious costs there, and you can see the average lost time is 47 days, right? That's nearly 10 weeks. And as you were aware, the longer someone is off work, the more likely it is that they won't go back to work. So that's a huge cost to everybody. If we look, at a European level, I mean, some of you are probably aware that up till very recently, the European Union were looking at developing a completely new directive called the Musculoskeletal Disorder Directive to replace the existing regulation on manual handling and display screen equipment. So as part of that process, they did a cost analysis of musculoskeletal disorders, which was carried out by a company called Matrix Insight in London, who are a kind of economists, right? They're kind of financial people. And their study showed that up to 163 billion is the cost estimate of work-related musculoskeletal disorders across the European Union. And their figures for Ireland were specifically around 611 million. So again, there are different costs, but there are different figures. But certainly, this was a very credible report. It was, it was presented to the European Union a couple of years ago. So, there is a shift in focus, even at a European level now. They recognise that that something is gone amiss. That the risk management approach needs to be addressed. So, they didn't go ahead with the directive in the end, but what they did do was they issued a council recommendation. And what that council recommendation says, which was just published last year, was that member states need to develop and strengthen legislative measures to minimise exposure to risk factors originated by poor ergonomic conditions in the workplace. So again, it's not very different from what we were talking about. It's looking at the work people are doing, looking at the unfavourable ergonomic conditions and making improvements. They also said that we need to ensure the effectiveness of these measures by providing adequate instruments and resources to implement and enforce them. Now, the Health and Safety Authority, we produce guidance, but again, there is a lot of very good guidance being produced by other organisations as well. And the idea that we need to disseminate this information, we need to get the message out there. I suppose I look at the ergonomics risk management, is evolving from a situation where, historically in Ireland we spent a huge amount of emphasis on just training, particularly just manual handling training, but we need to move that. We need to move it along to incorporate training, risk assessment, and then an ergonomics risk management approach. So very briefly, what am I talking about in terms of risk management and ergonomics risk management? Well, I mean, over the last number of years, visiting workplaces in Ireland, where you see good practice and bad practice, I'm a firm believer that unless you have a certain commitment at a management level, a senior management level, things will not happen. Whether that's manual handling, ergonomic risk management, or whether it's health and safety management, or whether it's quality management, it doesn't matter. Because, a lot of issues in terms of ergonomics, they do need, in some cases, they do need to be proactively addressed by senior management. So the policy aspect is very important. What I mean by policy is I'm not talking about a 5-10 page document. I'm talking about a simple approach where the company in their safety statement, particularly companies where manual handling could be a potential risk, that they have a simple policy in their safety statement which outlines what they do as a business, what their activities are, where there are manual handling risks, where they acknowledge that there's manual handling risk, where they state that they recognise that there's regulation there to be complied with, and also, most importantly, where they document how they're actually going to meet that requirement in terms of looking at risk assessment, providing resources, providing training to people to do these risk assessments, and most importantly that they will provide the necessary supports to implement any improvements that may be required to address risk. So that's policy. Risk assessment and safe systems of work, very, very important. Again, I mean, there's a lot of very good work done on risk assessment. We have our own, kind of 5-step approach on risk assessment. But the Health and Safety Executive have produced very good guidance around, the use of the MAC tool, which is a very credible and well recognised tool. You've got the NIOSH lifting equation. There's a number of different tools out there which give very good quality information on terms of, documenting risk. But the most important thing I will say about risk assessment is that you have the data, you have the information about the job, the technical information, what kind of weights are you dealing with, what kind of postures, what kind of environment is the work being carried out. All that is important because ultimately that will determine how credible your safe systems of work are, or your outcome, what your control is, what your changes are. And then that feeds in very nicely then to training, because a lot of work has been carried out around training and where it fits in. And one of the important things, particularly in a report carried out in the UK a number of years ago, it did say that training has a huge part to play, but it has to be incorporated into an overall risk management approach. So it can't stand alone. It has to work with risk assessment, safe systems of work, policy. And again, the other area is very important: accident and near-miss reporting and investigation. This is another element that we put into this, our new guide, because we did some research in the healthcare sector a number of years ago, and the report is on our website. But one of the interesting things that came out of that report was, in some of the cases that we got access to case study information on actual serious injuries related to manual handling. And what it showed was that in some cases there was no record of the accidents whatsoever actually occurring. There was no records, there was no investigation. So it's a very important part of the process. And again, in terms of trying to determine what caused an injury, or if there was a failure in a system of work, well, that has a knock-on effect in terms of maybe looking at doing a risk assessment in relation to some activity that is presenting a problem. So, again, that's a very important aspect. We also put into our new guide, which is, I'll give you the information in a second, but it's the Guide on Prevention and Management of Musculoskeletal Disorders in the Workplace. That's what the guide is called. We put in injury management, rehabilitation, return to work. We put in a section on that because, albeit it's not the remit of the Health and Safety Authority to manage that, it is recognised by ourselves that if people are off work, particularly in relation to the data that the occupational injury benefit claims, people are off work for long periods of time. So it's good to be proactively looking at how you're going to try and get someone back to work, and how you're going to link that in with your risk assessment and improvements that may need to be made to support that person getting back to work. The final part of the jigsaw, which I think is a good way to move, is an internal audit. We have an internal audit tool in this document. Now we're going to refine it and improve it and apply it in the next number of years. Our inspectors are going to be disseminating it in workplaces. But this audit tool is really kind of asking objectively, what do you have in place? So it goes through policy, what do you have? Have you got the policy? What's in the policy? Does it address this? Does it address risk assessment? Does it address systems of work? Does it address training? So the audit is broken into the different areas: policy, risk assessment, training, injury management. So, there are the aspects. That's the guide that's available. I'm sure the presentation, if people want copies of the presentation, that's no problem. But this is the guide. I'd urge you to get this information, because everything that's in there is very relevant. It's very relevant to companies from a point of view of yourselves as experts in the area of training and risk assessment, but also in terms of potential claims, because ultimately what we find is, particularly in relation to civil claims, is that a lot of the judgments refer to the lack of risk assessment, the lack of safe systems of work, the lack of training reflecting the type of work people are doing. So that is important. So just to conclude, I think there's a lot of very good work going on in Ireland in this area. I think we certainly we have to recognise that we continuously have to improve. We're all learning. I'm learning every day when I go out to workplaces. There's lots more we can do. Work is changing. The working population is changing. The age profile of the working population is changing. So we have to recognise those factors into the future as well. So work activity, needs to be designed and planned with the person in mind. I think we can't, if you take something away from my presentation today, I think that would be it, that we need to consider the work people are doing and how we can improve it, where it's needed to be improved. We need to be looking more at engineering, innovation and change at workplace level to avoid or reduce biomechanical stress or risk factors related to, manual handling work activities or activities where, kind of upper limb disorder, there's a potential risk of upper limb disorder. We need to place the emphasis on risk management and prevention as opposed to firefighting and accident investigation. We need to incorporate the learnings and outcomes from our risk assessment process into training programs. We at all times need to consult with those that do the job, but those that are doing the job also have to cooperate in terms of implementing measures. It involves us all. Everybody has a responsibility. And finally, I'd ask you to just take time out to refer to relevant guidance that's available. As I said, we have guidance on our website. If you want to talk to me afterwards, we have a number of different guides. I'd also say I recommend that you look at things like the NIOSH lifting equation, RULA, the HSE Mac tool. There's a number of different tools out there. So thank you very much for listening to me. I hope you got some insight from that, and I'll leave it at that. So thank you very much.